veteran
Recording
services.
in progress.
The more I talk to people, the more I'm constantly learning. Laura, do you want to jump off and start us out?
Sure. So I wrote down a few things that I see that a lot of people utilize. And then there's some things that people aren't really aware of that they could utilize that are a free service. Every veteran is unique, so let's start off with that. Everybody has different service dates, service times. Some are peacetime, some are wartime. Joel and I work together all the time, but that doesn't mean we're entitled to the same benefits. Just like I've worked with Chris Franklin, that doesn't mean we're entitled to the same exact benefits. We have presumptive benefits, presumptive conditions for disabilities, and that's all based on time served and locations where you served. So not every veteran is created equal because they just have different benefits. So one thing I want to talk about that we do have here that maybe not so much everybody is aware of is our vet center. A vet center is a counseling center. It's on Garfield in Clinton Township. It's federally funded. It is VA employees. It is a branch, kind of like the, it is independent, but it is part of the hospital, the VA hospital. But this is where they can get local, I would say, readjustment counseling for people with PTSD and things of that nature. We also have a dedicated food bank, which is the Vietnam Veterans Chapter 154. I don't think any other county in Michigan has a dedicated veteran food bank. And I know Chris Franklin and Sue Franklin, they also help veterans with food down there. I know I am the only county that offers a free volunteer tax program. So if veterans are within our scope of ability to do their taxes, like they don't run a business, have employees and things like that, if it's within my scope of being able to do it, then we would take that on and do it. We run a low income tax program, and for the public, it is low income, and we did over 2,000 returns. But for veterans, I take the income limit off the table because I want to see more veterans and I want to help more veterans. So we also offer transportation to the VA doctors at the VA hospital, and we're now up to 4 days a week. Before we were at 3 days a week, and then obviously we stopped during the pandemic. But now I believe we're up to 4 days a week. And that's contracted through Macomb Community Action, and they do have wheelchair capability, oxygen capability, and they do have the ability to do door-to-door. So one thing that we do very well here is our transitional housing for homeless veterans. We have a great network of community programs or community providers where we triage homeless veterans or veterans at risk of homelessness to try to get them the resources to stay in their home and keep their home, or to transition with dignity to a place, whether it's a hotel, it's the shelter, if it's a family with children or whatever, but with dignity and ease to get them back on their feet and self-sustaining. I would say our main job at the county is helping people do their VA disability claims and walk them through that bureaucracy process that is very difficult to understand. And we have 9 counselors at our office that just really assist with service-connected disability, non-service-connected pension, and discharge upgrades and other benefits. We have something also called the Trust Fund and Relief Fund. The Trust Fund is a pot of money from Lansing that's statewide, and wartime veterans can tap into that for emergent need. The applications come through our office, and we assist people with funds, and it's grants, it's not something they pay back, when they have emergent needs. So it could be car repairs, home repairs, it could be late on their rent, mortgage. People have asked for a million different things, and we have two committees that will look at it, their trust fund and the relief fund, to see if they can help this veteran go through this. But along with emergent needs, we see veterans needing free financial coaching. So it's one thing to help somebody who's in dire need and to help them get back on their feet. But some of it is, how I say this kindly, behavior. So it's, they pay this first and instead of paying that first, and, rent was always last versus first. So financial coaching is free of charge. She does not sell anything. And what she does is she tries to help people get where they are to get where they want to be. So whether it's financial independence, whether it's to buy their first home and to help them learn how to save and tap into resources that help pay for a first home, it's a big education process. And she does it very well, our financial coach. And it's free of charge to any veteran and any spouses of veterans. The other thing I wanted to mention was our state veterans home, which you mentioned, Lori, which it did open already in May. So it has been open. We did I did set up some tours about a week before they opened. They currently have, I believe, 36 or 38 living veterans living there. Their problem, they have now a long waiting list. The problem is they don't have enough nurses. So running a nursing home, you need caregivers, you need nurses. And if they can't have those nurses, they can't have more veterans move in. Because obviously they're tied by state law, how many, nurses and doctors per X amount of residents. That's not my wheelhouse, but I do connect people with the enrollment process. And I can connect people with how to, get on the waiting list and what it is. Most people thought it was actually low income housing, or it was just veterans apartments, and they wanted to get on that list. But it's an actual nursing home. So it's not short-term rehab or anything like that. So like I said, I'm not the expert. The state runs it. They have a great staff over there. I connect them to the right people. I have the application, not something easy that you fill out. I mean, it's got to be filled out by doctors, chest x-rays, 3 or 4 years of medical records. So it's not something you just sit down and have done in 5 minutes. So in a nutshell, that's a little bit about what we do. We do a lot of things. And I guess my biggest goal as a director of the county services is, my goal is to reach every veteran, touch every veteran, and let them know what they might be entitled to. And that honestly is our goal, because like you said, it's a, veterans, it depends on the era that they served. They don't want to tap into their benefits. They feel it's for somebody who's missing a leg or somebody else. It's not for them. They think it's a charity. And no, it's not. It's a benefit. This is something they earned, and we need to teach them and train them that, hey, you might not need this now, but you might need it later. That kind of thing.
Definitely.
Wow. Is that help, Lori?
That was a great, thumbnail sketch.
Thumbnail, yes.
By no means is that exhaustive list. Mm-hmm. And I hope people who are participating are starting to see that we have people in our community that we can turn to with those questions and ask for support navigating it. I think that's one thing that I encounter repeatedly is, government bureaucracy can be overwhelming and frustrating. Mm-hmm. And sometimes that's the biggest deterrent to engaging those services. Mm-hmm. So I want to hand it off to Christina, Joel, and Chris. And I'm hoping you guys will weigh in from the perspective of veterans who may have utilized services, or I know that you each serve in a capacity where you help other veterans and you have these conversations. And I'd like to know what kind of conversations are going around in the community around services that are available and getting access to them. Who wants to jump in and start us off? Go for it, Joel.
All right, thank you, Laura. Yes, hello, everybody. First, I have to say, as you heard Laura Rios speak, I'm glad that I'm able to work with her on the Veteran Service Committee, because she truly is an expert. And the one thing that we look for is to do everything and anything we can to help veterans. And, it's like I try to explain to veterans, sometimes we have conversations, it's not pie. It doesn't mean that, if you get a slice, you're taking something from someone else. utilize the resources that are there. That's one of the big things for me that when I was able to join the Veteran Service Commission is about outreach and just talking to vets. And sometimes I think our egos get in the way of asking for help, but it's there. Utilize it. Utilize all the things that you can, because that's what everyone's there for. That's like Laura mentioned, the veterans counselors that are there. They're there to provide, information to help, especially for people that, can file claims and have things, as far as disability and everything. Those can be very complicated things. And sometimes, you need that expert to help you with it so that, you can get a positive outcome. And that's really what we're looking for, and even on our commission, at times, I mean, there's people that are struggling, especially, with COVID and everything that's gone on for the last 2 years. We don't want to see a veteran get their lights turned out, or, get evicted from an apartment, or, things like that, or maybe their furnace went out or something. And if we're able to help, that's the big thing, is just to help as much as we possibly can. And really, for me, it's just to get as many people, as many veterans as possible to utilize the resources at hand.
Definitely. Sometimes it's just a few stopgap measures that keep it from snowballing and becoming more critical and having more serious consequences. Thank you. Chris, do you want to jump in with talk about what you're hearing from the community locally? What kind of benefits and what kind of assistance do you have community members reaching out about?
Well, I'm honored to be here, and I'm honored to be on this panel. And I can give kudos to Laura Rios, because she is one person who, when I call her, because I'm not a service officer, but I understand some of the stuff, and I've taken a few classes on it, but things have gone somewhat awry with my health, so we're still working on all that. But I know when I call her, she has the staff and the support, and she's helped out a lot of guys, the veterans that I've steered over there. And I know they're in a lot better place now than they would have been. And that's about all I have at this time.
Yeah. Christina?
Yeah, everything that Laura said, I can, that's exactly what I would recommend. We do have the Macomb County Vet Center. I know I'm telling people about that place all the time. A lot of veterans here just in our county don't even realize that we had that here. And the services, they have a lot of services that are offered there. They have a lot of different support groups and different types of support groups in different ways. I know they even do, they were doing yoga at one point in time. I don't know if they've gone back to the yoga yet because of COVID. They have. Laura shaking her head. I know that, that was a big thing, a bunch of veterans doing yoga. A lot of people, it's a stigma that it's out there that, they're breaking down those stigmas every day, trying to break through on some of those. And then some of the other services, Laura nailed them all, that are available. But the biggest thing is, the veterans here don't know how to get to these services. They don't know who to contact. And that, that's one of the things that we're working on. It's one of the things that I'm actually working on here in Warren. We're trying to get our own Warren City Commission put together. Yeah. Well, I've been working with Laura to try to help get some information here, and, just so that we can help steer more veterans to the right places. We're not trying to provide extra help, but just make sure that we're providing the resources that are there, making sure that other veterans find these resources easier.
Yeah.
So.
And thank you for bringing up support groups and kind of these informal opportunities to check back in and have these shared experiences. On our panel, we have a variety of military service across generations and different experiences, and some have common experiences, and some have very different, unique experiences to their time and types of service. And a big thing that I hear is, when you come back and you re-engage in civilian life, that it's hard to have certain conversations with people that don't have those shared experiences. Okay. Well, I think we got a good overview of what's happening here in Macomb County. Let's have some conversations around what are we doing well. And by attending the Veterans and Military Family Gala at the beginning of November, we really got the opportunity to shine a light on what is going well as far as resources, services, and engagement. But let's also tackle what are some barriers or challenges, things that you personally navigated, things that people have reached out to you for help with. Who wants to kick it off?
Well, I'll talk about my experience. When I got back from my deployment, one of the first things I had to do was go to the VA and talk to them about, things that were going on. A lot of us that came back, we did have PTSD and we needed to be seen, and they wanted, just to be screened. And just navigating to get my first initial appointment at the VA, it took 8 months. And it just seemed that was, unreal to me to take 8 months just to get in to be seen. And then being a woman veteran, there's a lot of other hoops that we had to jump through. And in order to be seen by female, certain types of female doctors and stuff like that we needed to be seen by, they were only available 1 day a month to us. Out of the whole month, it was just 1 day, and so if you couldn't make it there between, 9 and 3 or 10 and 3, whatever it was, you had to wait a whole nother month just to be seen. So there were a lot of challenges that, we didn't know going into, that, where it would have been a little bit more helpful to have that information, knowing that, make sure that you schedule those appointments first, making sure, a lot of veterans don't know that when you first go to the VA, you should be having like an introductory type, where you're there the whole day, and they kind of take you through the VA and take you through the different steps and take you through the different processes. And a lot of veterans, when they're coming out of active duty or they're coming off of a deployment or whatever it may be, they don't really necessarily know that these are things that they should be getting. And there's just no way for you to know that unless you go through it, and it's hard when you don't know. So making sure that, we have these checklists or have people in positions like what Laura does, making sure that, we're helping as many veterans as we can, making sure that they're getting all of the benefits that they have coming to them.
Yeah, that's helpful, knowing that they can do a whole orientation session. The more I learn, you have one series of protocols for once you're in the military, and then as you're transitioning out, there's a whole another series of protocols.
There is. Yep. Does Joel want to talk, or Chris?
Well, what I was going to say is just, I think there's a lot of things, you're talking about they're being done well, but oftentimes a lot of it comes down to money, and, resources have to be there. I mean, it's something that, you'll hear a lot of times from people that, there's always money to send people to war, to combat or whatever, but taking care of them afterwards, you don't see quite that same inspired amount of funding in order to do that. Now, it doesn't mean that everything's bad. It just means that it's something that, on the federal level, the state level, local level, whatever, the more that we can do, the more resources that we can make available are certainly going to make a difference. And I think that that's something that, always want to keep in mind. And I think also, it's something that veterans want to speak up. We need to make our voices heard. We need to make sure that elected officials know that, there's things that we need as veterans, and we need to make sure that, we push elected officials to make sure those things happen. And that's something a lot of times you see that the veterans aren't voting maybe as much as other, other areas or other demographics and everything. And that does make a difference. I mean, and it's something that, again, it's not a matter of being so involved in politics. It's just a matter to make sure that you're represented, that we are as veterans are represented. So I hope that's something that, veterans are aware of, and make sure to reach out, reach out to elected officials, reach out to regardless of where they're at, whether they're at the federal level, state level, or local level, but make sure your voices are heard, because it does make a difference.
Absolutely, Joel. I appreciate you raising that, because we have, community engagement opportunities. And I think the general public gives elected officials way too much credit for being omniscient beings. A lot of us know a lot about a very specialized experience, mine being education, that being my background. But I count on community members, people who are professionals and experts in the field, on helping to inform me, educate me, keep me up to date on things that are changing or things that might, votes that might be taking place, budget appropriations that might be taking place, or things that they see are falling short on. Because I think people think once you're elected that you see all and you know all, but you give us way too much credit. So I appreciate you doing the shout out for engagement and also for funding. So the biggest piece of government funding at the federal level is military. And I think military needs to include entire lifetime, like you said, of resources and benefits. It's not just for active service. So good points. Chris, Sue, do you want to weigh in on things that you've encountered that have been effective and efficient, and as well as things that you have encountered that have been problematic or maybe frustrating?
I do.
Come on.
How do I get on here?
You are on.
Oh, I am. Okay. One of the things that we have encountered, and it was when Conyers was still alive, one of his aides called me a long time ago about the lack of Native Americans coming to get veteran services. And part of it is that a couple of them I had heard from is how disrespected they felt when they went to Detroit for services. And when that gets out into the community, they just don't go. So how Chris came to be here, he volunteered here a lot. And the president of our board came in one day and he goes, "You got to hire that guy." And I said, "I can't." And he said, "Why?" And I said, "We're a federal contractor. And they have this thing about nepotism. I can't supervise somebody that I'm related to." And I said, "Besides that, I don't want to be my husband's boss." And he said, "Well, that's easy. Put him under my supervision." So Chris works directly for the president of our board, and I work for the board. And so we're actually co-directors of Southeastern Michigan Indians. And our board really, where we had been more of a membership organization, kind of a club at one time, they really wanted us to get into human services. We're really digging our heels in and doing things to help people. And in the American Indian community, we hold our veterans in very high esteem. They are our protectors, and we always do what we can to help them. And I can remember that even when my uncles were serving. And our grandson is currently in the U.S. Army. He's stationed in Hawaii, tough duty over there. But we actually have 5 generations on my side of the family that have served in the Army, beginning with World War I. So that's always been around me, and I have great love and respect for our veterans. But one of the things we had was a female veteran. She was an Afghanistan veteran, and she came home and she really had some adjustment issues. And she wound up moving into a home in Clinton Township, and her house was broken into, and she came home from dropping her kids off to school, and this man attacked her and beat her. And so there's a police report made. They did catch him. And so anyways, shortly after it happened, she called Chris and told him what happened. And he said, "Well, come here and let Sue and I take care of you." So she came over and she explained what happened. And as this thing proceeded and it went through court, and we talked to her about the traditional ways of handling this, the loss that she felt, and we were able to provide that to her. And so when it came time to go to court, Chris called BVA 154 and he told him what happened. He said this veteran could use some support. Well, about 40 of them showed up with their wives. They just overwhelmed the court, and they let it be known to the people that were there, this guy's friends and buddies that thought they were going to come up and act like punks, that this was one of their own, and they were going to take care of her. And he was convicted, but all of the support that this young woman received from other veterans, the veterans that are coming back now from Afghanistan and Iraq, from those wars, have had a lot of trouble finding a place that they fit in, like the Vietnam veterans, and they don't really have anything like that. And it's not for a lack of people trying, with Laura trying, Chris trying. It's just the nature of these conflicts, young men and women that are coming home, and they're deeply affected, by what they did in their service time. But when COVID is not going on, Chris talked to me about the things he thought would be important. We make decisions together. And when it's non-COVID time, he tries to arrange social activities where there's times when people can come together. We strictly enforce, no drinking, no drugs, no smoking. And it sounds like it wouldn't be any fun, but it is a lot of fun, and we have a lot of veteran participation in those things. And, on the business side of it, he had a Veterans Cafe here, which was a talking circle for veterans to come, and it was a place where they could meet confidentially and talk about whatever they needed to talk about. And we offer employment services here that's not too different than anybody else, but we are a grantee for the Department of Labor, and we have a Veterans First program here, so any veteran is welcome to come here, and we'll help them. And the other thing I wanted to mention too is that I'm the chair of the Michigan Multicultural Network, which is we formed under the Michigan Department of Health and Human Services quite a number of years ago. But last year we incorporated them, so they're independent of the department now. But that was always about the 5 major ethnic groups: the Arab, Asian, African American, Native American, and Latino cultures. And about 5 or 6 years ago, we opened that up to include LGBTQ and the veterans community, so that these are all classifications of people that seem to have a disproportionate amount of equity and social justice. And so where we had limited ourselves before working with the department, it was really to commercial tobacco use. But this has opened us up where there's a lot more that we can work on the other issues. And this is new, beginning this year, where we're starting to meet on some of the other things that we want to tackle. But our veterans and doing what we can to help them has become a priority, of course, always for Chris, but certainly for myself and our board. So I've made some notes here. I think that that's probably about it, but we just, there's a lot of anecdotes about the veterans who have come here. And, I don't know how they find us, but they'll find us, and what we can't help them with, we direct them to Laura, or sometimes we do case management with other agencies. And I know that when Tyrone Chapman was, still with us, he used to bring a busload of his transitional housing clients out here to the center. And if we had something going on, they would come out. But it's just really important to know, for people to know, that while we might not have all the bells and whistles and all the services, this is a very veteran-friendly organization. It always will be, simply by the nature of who we are, and our hearts will always be there to help vets.
Thank you so much. And thank you for raising up underrepresented voices and making sure that they have cultural communities that they can seek that additional level of support from. It's so important. And it really speaks to, we have very formal, structured resource networks, but we also have community-oriented, less formal support social networks as well within our community. And it takes both of them to help community members and veterans and their families navigate the system. I'm going to take this back to Laura. And what are some of the things that you've, acknowledged and recognized? I mean, really, you raised up so many of the programs that are available and are done well, and truly being shouted out and raised up, and being recognized for doing them. Also, things that, I mean, you already started to identify some of the barriers and challenges, even just encountering policy and statute, and trying to marry the military way with people who are writing policy that might not have that background and experience, and not understand how people could fall through the cracks just because terminology isn't integrated into the law correctly and accurately. Want to touch on any of the specific issues, programs, or go in any direction you think needs to be addressed?
Well, let me first start off with, I would say my biggest challenge when I sit down with an individual is there's homework. If you want to do let's just talk disability claim or pension. There's two pots of money that the VA can offer a veteran monthly. Most people don't realize this, but there's two different pots. One is service-connected disability. I was injured in service. It's a chronic disability. It continues for life. Could be a back, could be cancer, could be just about anything, but it's something that starts in service and that is chronic. So we have that type of money that's available. It stops when the veteran passes away. It can be raised, it can be lowered as, the disability gets better, gets worse. You can do a lot of roller coasters the whole time through your lifetime, but it stops. So widows think that, well, it's just like a Chrysler pension. I should be able to get half. And that's not how it works. So it's really educating the law to, surviving spouses or veterans. The other thing is there's another pot of money called non-service connected pension. And this has been designed years and years and years ago to keep people from being homeless or unfortunate. So usually who qualifies for this is you have to be a wartime veteran, 90 days on active duty, 1 day in a wartime era if you served before 1980. If it's after 1980, it's 24 months in a wartime era. But this money is designed to help pay medical expenses. If somebody has no income coming in and they're disabled and they're fighting Social Security, which usually happens when people apply for disability, this program pretty much pays fairly within a couple of months, and it's a monthly benefit, but it's income based. So if they win their Social Security disability, then it's dollar for dollar removed. So for a disabled for a pension alone, it could be $1,000, $1,100 a month. For a widow, it's $700. But then they have a category called aid and attendance. So a lot of people hear about this program and they just call, hey, I'm here about the aid and attendance program. So usually who qualifies is when their medical expenses outweigh their income or consume their income. If somebody falls, breaks the hip, on ice, and then they go to rehab, then Medicare or whatever insurance only pays so many days, then they have to go to long-term care because they can't go home yet. Then it goes to private pay. And then that's when they start looking into it. Because really nobody can afford $8,000 a month for a nursing home out of their pocket on a daily basis. Some people could, but not most people. So this helps defray those costs. A widow can receive it, a veteran, a married veteran. There's all kinds of scenarios. But let me tell you, this is an income-based program, and there's a load of homework, and it's not easy to navigate. Just like the disability claim, it's not easy to navigate. My biggest thing that I like to educate people is I'm here to help you, but it ultimately is your claim. I have my own claim. I have to go to the doctors. I have to get opinions. I have to get medical records. I can't do that for you. So I can't go to the veterans doctor's appointments for him. They can understand that. But when they want to submit 20 conditions, that's 20 different medical opinions. That's 20 different medical records. So, then they quit because it's just too much work and it's too much bureaucracy. Well, don't look at it that way. Look at, okay, what's going to pay you the most money? What's going to compensate you the most? let's start with those and just work with 5 or work with whatever. Let's do baby steps. You know, you bite an elephant, you eat an elephant by 1 bite at a time. So let's look at that instead of trying to submit 20 at a time, because you're not going to win them all. But we have strategies. So, you know, we have a team of people that can help. I think a big barrier is people with only VA healthcare. It's great healthcare, but it's a complete barrier if you're trying to do a disability claim. Because not one VA doctor is going to give you an opinion letter that you need to win a disability claim. They're not there to do that. They're there to treat your disabilities. They don't care where you got your disabilities. But when it comes to claims, I have to have opinion letters. I have to have this homework done if you were out of the service more than 12 months. So I get a lot of people yelling at me, and I don't take it personally. I get a lot of people that are angry, and I just have to explain the law the way it is. And, you know, to change the law, you change it through Congress. You don't change it by just writing a suggestion to the suggestion hotline, because any changes usually cost money, and money has to go into the budget. And you know how the budgets work. So I would say there's great things that work well. You can get VA healthcare. By all means, they're going to take care of you. What's a barrier? Getting the opinions to get the disability to win your claim. And one of the biggest things, the hard thing to win is PTSD. And a lot of people suffer from that because it's just not an easy transition coming back to the States after deployment, seeing, doing, and everything that you've done. And I've been deployed twice, so I know how that transition happened. It's not an easy road. So my goal is to break down the barriers. If somebody needs emergent, like what Christina says and what Chris says, if somebody needs help right away, whether it's mental health or whatever, hey, disability claim can be on the back burner. My goal is to take care of your health and take care of your health now. We do also have a mental health navigator. So if somebody's not eligible for a vet center, you know, I'll give them over to the mental health navigator, because their job is to see if they can use the county resources, the county mental health system, the VA mental health system, the vet center's mental health, but they have all of the different resources for mental health at their fingertip to see which is the best way to case manage this person and get them care. And sometimes inpatient care is the best care for the emergent need. And to get inpatient care at the VA, not as easy as you would think. They're always full. They're always booked. There's not enough beds. So it's really navigating what's available in the community and seeing if the VA can pay for it. So that's what our collaborative team is really for. I can't do it all, and I'm not the expert of it all. But when I have somebody on my team that does, like I call mental health navigator, then that's their expertise. I have somebody, a financial coach, that's their expertise. I have someone that just does the emergent needs, and that's her expertise, because she's up on the latest trends. And I wouldn't say trends, but you know, the SARA money, the COVID money, this money, that money. We want to use all of those resources before we tap into the taxpayers' money, because that's ultimately my last payer, the last resort. So let's use all the federal dollars before we use the local taxpayers' money. But we do things, I would say we've got a good oil machine to navigate and help, if anything, the resources that we have available, and to help connect people with the right resource.
You give me a whole new appreciation for how many different levels the system works on, and new appreciation for what your department does and how it all fits together. You know, I see it from a general public health and public community support network, and where we're already experiencing shortages around mental health providers and beds and inpatient, and then add that layer of, you know, veterans and veteran services on top of that. And I have a whole new appreciation. I've been taking copious notes, is what I do best. Mm-hmm. So I truly appreciate these insights from everyone. Let's take a deeper dive into any goals, objectives at the state or local level, what are we working towards? Do we have, some measurable things that we want to achieve? Any thoughts around that, Laura?
I'll start off with that one because I have some thoughts already written down. So a few years ago, Governor Snyder passed a law, and it was the county incentive grants. And it's to help each county, because we have 83 counties, but we don't have 83 veteran offices. So some counties are very small and they don't have a support network. They don't have an office like ours. Most of those counties are, I would say, in the UP or where there's more deer than there are people. So it's all more up the north, or you call it the north upper, the north lower, whatever. Yeah, it's just up north, where everybody's winter cabin is and summer cabins are. But the goal is to help have this funding to help establish an office, have this funding to help connect veterans to their benefits. So I'm a big advocate in reaching out for grants and how can we use that grant. So I sat around a table, this was a few years ago, and every year we re-look at it because every year we've been blessed. This is our probably 4th year or 5th year receiving it. And every year it's a different amount. So it could be 50,000, could be 100,000, could be 200,000. Every year is a different amount. But last year, a couple years ago, we sat around the table. What can we do with our money that really could help the veterans in our community, whether it's to reach them, get them to reach us, or whatever it might be. So some of the things we've done is we've done a vet fest at the community college, and that was about 5 years ago, 2016. And it was a big resource day, and it was around 9/11. It was a Saturday close to 9/11. And it was to bring veterans there to connect them with resources in the community. We had over 100 veterans there that day. The prior year, we had like 15 come because it was actually on 9/11, which was a weekday. And it's not a national holiday, so most people didn't come because they had to work. So we haven't done one of those in a while. We have done, last year I offered free dental. Dental is a huge barrier. It's a huge barrier, as if anybody knows about dental health care. If you don't take care of your teeth, that can, really connect to disease, connect to, more problems throughout your whole body. And that's according to the dentist, not according to Laura. So we wanted to pay for at least exams and cleanings and x-rays for veterans. And the first time we did it, we had 50 people on the waiting list because we can only do like 18. 2 per hour, and they had this, and we used MyCare and Centeline. And MyCare is a great, nonprofit organization that offers dental care on a sliding scale to people of low income. And so we've got a great partnership. But then last year we did it, and the first time we did it, it was like maybe 10 people came. And then the second time we had 1 person. And I'm like, well, we have to cancel the rest of these events. That doesn't mean nobody needs dental care. It's just that the word isn't getting out. The advertising isn't getting out. Something is a disconnect, but we still are able to help people with dental through our trust fund and relief fund because it is an emergent need. And the VA does not offer dental. You would assume as somebody in the community, oh, the VA hospital has dental. They're going to take care of every veteran, and they don't. They only take care of 100% service-connected veterans. So what do you do with everybody else that doesn't have dental? When you have dental pain, that is ultimately the worst pain ever. And that's an emergency right then and there. So we get it. We wanted to use that money for that. We've also used the money for gas cards, bus passes, food vouchers, and other things. So our focus really is advertising. Because if I can advertise and I can get 10,000 hits to my website, they're at least reaching out for some type of information. My goal is to get them to call because every phone call usually leads to an appointment, whether it's an appointment on the phone, appointment virtually, or appointment in person. But that's one of my big objectives is really reaching out and getting those veterans in the office. And What would I like to see, happen is the governor support that grant and continue to support that grant. And so far, our current governor has done a great job, and she's supported it. And every year the money changes. So it's obviously based on the budget and what's available. The other thing,
You know what? I'm gonna jump in there, Laura, because I'm gonna circle back to what Joel said. We need to make sure that our community veterans know what that line item is, because businesses and special interests, they're in Lansing lobbying to make sure that their line item stays intact or increases. And so we need to make sure that our decision makers on state budget know what that line item is when they come to Lansing, and know where it's going, what it's used for, and make sure that it's staying intact.
mm-hmm. I agree. And the only other thing I would like to mention that I would say my goal, and it's been my passion for the last 5 years, because I found a widow of a veteran that fell in this category, is to expand the property tax exemption for widows that receive DIC, which is death indemnity compensation, which means their spouse died from a service-connected disability. It only pertains right now if the veteran was 100% permanent and total, and it would continue to the spouse. It doesn't pertain to the widow who, submits a claim, wins her claim. Well, my husband died from a service-connected disability, but because he never submitted a claim, or he wasn't 100%. We have veterans that die from hypertension. We have lots of people in the community that die from hypertension. But you know what the VA rates hypertension? A 0. So you are service connected. If it is your service connected disability, but it's never going to get them to 100%. And I've had a handful die from hypertension. And it turns out that the hypertension was what the doctor puts on the death certificate. But once again, education. My goal is to educate every veteran in our community. So thank you, Lori.
Yeah. And I'm going to circle back to each of you. So if you have thoughts on metrics that we need to move, maybe around health, around employment, engagement, I'm gonna ask you what your wish list is. But I wanted to touch on that, Laura, because to me it seems like we're in the era of data, right? We have emails, we have social media. It seems like that a database, a communications database, should be the easiest way to push out information, so that there's newsletters going out regularly. And is something like that available? Is it, or does it need to be created, or are there barriers to creating some kind of communication network like that?
A newsletter? So,
or even just emails. I think about, because I get a lot of notifications in my position about what's going on. I remember getting emails and contacts about my care services for veterans for dental.
Yep.
And being able to take that back to my community, whether it is on social media to push it out, at community conversations. But it seems like, every step away we get from like that direct communication is the potential that fewer people are going to hear it. And so my question is, and the thought that's going is like, how do we create that communication network for veterans, whether they plug in, that information can be pushed out directly?
Well, it would be great that I could have an email address for all 50,000 veterans in our community. And you would not believe how many people call and expect that I do have that. And I have their addresses, I have their personal phone numbers, and they're like in my database, right here, And although we do track data of everybody who comes in our office, but that could be like right now, I would say in the last 15 years, we've probably seen 16 to 18 or 20,000 veterans. But that could be for burial benefits, that could be for widow benefits. It's, encompassing everything. So I will tell you, not one way works. If I did a newsletter and sent it by email, the World War II population wouldn't get it, the Korean veteran wouldn't get it, and the younger vets would just delete it because they don't have time to read junk mail. I send out so many emails from the collaborative that we think is, a great resource, like the POWMIA stuff. It could be just something going on in the community. And when I actually wanted to gather data from just the 250, 300 people I have on my email group, I had a staff member call every single one of them, and they said, "Oh, I just delete your emails." So obviously not everybody deletes my emails, but it got redundant that I was sending things out every day. And, it's the point of junk email versus important email. I will tell you right now, at home, I get over 200 emails a day at my home email. And now I have 5 emails. So really, what is the best way? I've tried to advertise in Macomb Daily. I did last year, my advertising budget was like 100,000. The year before, I think I did 200,000 because it's based on what I get from the grant. So we did TV commercials. We did Speedway gas station videos. We did billboards. We did newspaper articles. We did all kinds of push. Would you believe Facebook kicked us off? Because we discriminate only against veterans, and it's only for veterans. So we got kicked off of Facebook, and we can't advertise on Facebook unless it's for the general public. I do have a Facebook page for Macomb County Action Collaborative, and we do push things on that. I just did just tell you how networks work. I just did a big press release through the county. I've done advertising through my advertising company, and something as simple as sending out this information. Senior Services in Macomb County sends out a electronic newsletter. And I said, hey, I need volunteers for my tax program, and my class is this Saturday. So for the last month, they've been sending it out in their newsletters. We've been doing the press release. I'm like, it works. But not one thing works for everybody. So
you really hit the nail on the head there. And I definitely echo a lot of those sentiments.
Yeah. Now, I had someone tell me, she said, well, you should go door to door. And I'm like, really? So
then they won't be home.
I looked at, and this one was a county commissioner. And I'm like, county commissioners have, just like Lori, you have a small area that you take care of.
Mm-hmm.
And how many residents is in that small area? You're talking at least a couple 100,000.
90,000 for mine, but you got bigger and bigger as you go up the food chain.
Sure. So, sure, you should go door to door. So even politics, re-election, when you are doing door to door and you have a team of like 50 people going door to door, that still isn't going to cover everybody, because I'm not opening my door. You know what I mean? Because that's the Tupperware people, or not the Tupperware, but that's the kids doing football, whatever. But it's just like
fundraisers and outreach.
Yeah, I'm like, so it's really, who can you reach? I will tell you just a quick story. When the property tax exemption was first passed and it extended to everybody, that was 100%, not just people in a wheelchair. This was in 2012, 2013. The Township of Macomb added it to their tax bill to the residents. Now, you figure you got 50,000, I don't know how many, but that's one sheet of paper. It was added to the tax bill. It was separate, and it went out to every resident. We got 10 people that lived under a rock. One was 97 years old that qualified. That was a widow. And we had so many people that just, it's the easiest way to say it, they live under a rock. You can't reach them by television. You can't reach them by radio. You can't reach them by junk mail. And my goal, I was just so pleased that we could just help. When I saw a 97-year-old come in, a widow, I was just so pleased that it just helped that one person, but it did help more than that. It helped like 12 people, that they weren't listening to the news, that it was on the news for a long time. It was on every channel, but who listens to the news? Not everybody. So if you come up with that magic way to connect to everybody, let me know, and I will make
I will let you know. That'll be the $1 million solution. But and if there's any ways that I can help further that push out into the community, please let me know. We'll make sure we connect.
Thank
So
you.
I'm going to circle back as I promised, and I want to know, what are your metrics for well-being in our communities amongst veterans? What do we need to improve on? Chris, do you want to jump in?
Certainly. Listening to all this, I have to reiterate that I'm a stickler about tobacco and nicotine. And that's affected a lot of our veterans. And every way you can think of, nicotine affects your heart, your circular system, lungs. And a lot of our veterans are suffering from those problems now because they picked that up in boot camp. And a lot of them couldn't shake it. And
that takes me back to World War II rations. You got like three cigarettes in your daily rations. I remember going to some of the museums.
Exactly. I myself, when I went into boot camp, I was a smoker, 17 years old, but I couldn't swim. Here I am in the Coast Guard, and I couldn't swim. I didn't have the lungs for it, so I quit smoking. Fortunately, that was the last of that. And after I got out, I watched my buddies who did smoke get into problems with it right along, and their families and their kids, and that's developed into vaping. That's developed into so many different things that are not advantageous to anybody. And in the long run, I've reached out to Native communities all over the state. I talked to them about smoking, about tobacco use, and the spiritual use that we use it for, because we don't inhale it. And it's a completely different tobacco. If you look at our tobacco in comparison to the industrial or the commercial stuff that they put out, it's a completely different color. It actually looks like fish food because it doesn't have all the chemicals and all the stuff that they put in it. And maybe they were aware that it would make it addictive to a person. Maybe they weren't. But in 50 or 60 years, it's proven that it's hurt everybody. It's a hindrance to everyone. And I've talked to the Native community up north, my friends up in Beriga. And they, at one point in time, one of my friends who's the head veteran up there, he talked about how the board itself wanted to start a tobacco trade up there. And I told him, I said, well, let's just think about this. We, as Native veterans, are supposed to watch out for 7 generations, both in back and in front of us. In back, so we don't make the same mistakes, so we learn to help people. In front of us, so that we aid the kids growing up, our grandchildren, our great-grandchildren. I told them, I said, how would it look in 5 years when you're looking on a baseball field and you see half the kids standing out there with vapes or smoking? How far do you think they're going to be able to run? And then 10 years after that, what kind of condition are they going to be in? So my friend took that back to his board, and they nixed that idea altogether. So that was just a point that we had to get across to that community, that we didn't want to hurt our children anymore. And
well, and I really appreciate it, because you don't do it just within the Native community. You also do it right here within ours.
yes.
Working with the Warren Centerline Prevention Coalition, which is where I met you. And I really appreciate you sharing that vision in our community.
Yes, and it's helped a lot with everybody. I go down to all the reservations, and I talk to these people about this, and we try to give them all the assistance we can. Another thing is that we need to get service officers in the Native community. I have one fellow up north which we're working with VVA right now with the National, trying to get him service credentials so that he can help other veterans. He does it on his own now, but I know he could reach out a lot more if he could facilitate things through the state to help him with because it's not cheap to travel around and take care of all this stuff, especially in the UP. You're 300 miles from everything. So I know that that would help a whole lot of people up there. And the Native community themselves, they're kind of skittish about coming out and talking to just anybody. So having somebody on that board would be a plus. So we just keep hammering away at that. And
Well, thank you for continuing to build that network.
You're welcome. That's my honor to do that.
So tobacco and substance use and vaping, and making sure we monitoring those metrics and reduce the use and abuse around that. I appreciate that.
Lori, I have something else.
Jump right in, Sue.
Right before COVID started, we were contacted by Michigan Indian Legal Services. They're based out of Traverse City, and they wanted to put together a program like a mini conference down here, which would be open to all veterans. They were in partnership with UD Mercy Law School for expunging criminal records for veterans. And Chris had contacted Kara over at Macomb Community College. That was going to be the venue over there. Then, of course, we got COVID and we couldn't do it. So the other day I got an email from their attorney who's doing outreach down here about doing another one and planning those. But I know we have veteran court in a lot of the counties in Michigan. They're supposed to be in all of them. But, and that works for some of the stuff they're engaged in, but there are criminal records out there that do, can cause them problems way into their future. So that's something that we want to work on with partners down here in this area to go ahead and bring that into being down here. And hopefully we'll be able to do that sometime in 2022, is to do that expungement law clinic. And
thank you for raising that, Sue. I was had an opportunity to meet with Attorney General Dana Nessel today, and she was mentioning that as many as 1 in 10 Michigan residents has a felony on the record that could potentially be expunged. 1 in 10. That's mind blowing, and that changes so much workforce futures. And also bringing up veterans courts and giving people second chances to fix and take other approaches. Those are huge. Yes. So thank you.
Yep.
I'm going to toss it over to Joel. What kind of metrics would you like to see changed or improved within the veteran community?
Well, I think, Lori, as Laura mentioned and everyone else has mentioned, basically the outreach to veterans, just to try to communicate and connect better. I think one of the things that could happen is like what you're doing today. I think if every state representative at least twice a year would have something like this Veterans Town Hall, I think you would reach more veterans, you'd connect with more people. I think that's something that can be done, and it's, there's no money involved. We don't have to worry about funding or anything. But I think that that's something that, on the state rep or state senate side, more of these would get more information out. Because I think, everywhere, it's like Laura had said, if there's not a Veteran Service Commission there in that county or something, they could at least go to a neighboring county and get someone in to be able to provide that information. And I think that information, or especially education, is what's so important. Because you're right. I mean, sometimes veterans do get frustrated with things, but I always try to remember, I said, look, when we served in the military, things weren't happening quickly. Okay. So, I mean, kind of keep that in mind, that you're dealing with the same organizations in a way that you dealt with in the military. So don't expect it to happen overnight or, as fast as you'd like. But as long as, you have good people doing the work and you see progress happening, that's something that can make a difference. I know one thing for me, that I saw being an air traffic control specialist in the military, our license is transferable to civilian world. That's something I think, I pushed at the 40,000 foot level, we'll say, with, Senator Peters and Stabenow and, Congressman Levin. But at the state level, if there's something that could be done, so in order to make those transferable so that people didn't have to go through all this retraining and all this other kind of stuff, or, have to use their GI Bill for things that they already are able to do, I think it'd make a big difference for employment. Because
Thank you so. Sorry, didn't mean to cut you off.
No, I was just going to say.
Thank you for raising that. Yeah. There's a huge initiative in the 101st legislature around this, with working with the Department of Labor and Economic Development, is identifying those certifications and specializations that have a natural transition. And now better than ever, whether it is going into the classroom, working in the trades, working in medical fields, those are being recognized, acknowledged, and fast-tracked. So it's so exciting to see that what you're calling out it's in the beginning stages and it's happening. So if you see people who are looking for those opportunities, helping to connect them with Labor and Economic and Opportunity Department at the state level, let's help them. Okay, great. Thank you. And I'll take this town hall, and it's like, why reinvent the wheel? So if we have at least a skeleton of a town hall that other representatives can utilize and ideas for who they can reach out to in their community, I'll take that back and share what we did here, and hopefully we'll see it replicated throughout the state. So thanks. Christina, your thought.
If I could piggyback off of some of what Joel just said, a lot of our unions, they do have, like our construction unions, they have, our building trades unions, I'm sorry, they have programs for veterans to hard helmets, and they have veterans in piping and stuff like that. But a lot of those programs also, they start before they're veterans. So, you need to know those sort of things, because once you're out, some of those things, aren't available to you anymore, actually. So knowing that right before you're getting out, you've already started these transitions, that it goes both ways. We got to make sure that we're catching the people who are just getting ready to transition, to make sure if this is the road that they want to go on, that, these are the steps that they're taking to get into some of these programs. But a lot of the unions that, they work with the veterans either way to get them into the programs further along, because they've already had the training. Like Joel said, some things transfer, some things don't. And even though you've been welding or you've been doing whatever it was you were doing, in the military, it doesn't necessarily give you the same qualifications when you get out, which it should. And then another thing, I know we keep talking about funding and finding the funding. I know one of your colleagues, Representative Rich Steenland, put together a House Bill, 4380, that they're still trying to get it passed, but it would give our, let's see if I want to make sure I get the wording right. The bill would create service support fund. The fund would allow the state to accept tax deductible donations in support of members of the military, veterans, and their families. Our active duty, reserve, National Guard members and veterans, as well as their families, make many sacrifices to serve our state and the nation. And this bill would provide and create an avenue for increasing funding to support them within our communities throughout the state by leveraging additional private sector resources. So, I mean, that's a House bill that's actually, they're still working on it. I think it's past you guys. It's past the representatives, right?
Passed out of the House.
So we're waiting on the Senate. So, getting, follow through on some of these things that, you guys are working on would be great.
And call and weigh in. Let your state senator know that this is important, and that having additional funds and resources will fund programs that are essential in our communities. So thank you for raising up that legislation. Let's see. Last question of the evening as we wind down. We only have about 10 minutes left. We're left with what current veteran resources are most utilized or maybe underutilized. But I'm also going to ask you each, when you weigh in, to kind of leave us with a thought, leave us with an idea or some kind of thought-provoking question. What is the big idea that we hope people walk away with this evening? And while you guys are weighing in on resources, I'm going to go through the chat and see if there's any questions that we can touch base with on or follow up with after. So let's circle back to Laura. What are the most utilized resources and maybe most underutilized?
I would say the most utilized, you're going to laugh at this, but I want my Home Depot discount card. So you can chuckle, but even around Veterans Day, they want the list of places that, you know, is offering their free meals or their 10% off. But we would probably get a million inquiries about how do I get that veterans card so I can get my Home Depot or Lowe's discount. So, and there's many different cards, and each merchant accepts different ones. So some want just the active duty card or the retiree card. Home Depot, Lowe's, they want, you know, the Veterans Health ID card, which you have to be eligible to register for health care, and not every veteran is. And then the county came up with a veteran ID card that a veteran can pay $10 and get, and has their picture on it. It looks pretty official, but most merchants wouldn't take that. So the federal VA has tried to do an ID card online, and I really don't know how well that's working, because it goes through something like ID Me and tries to verify you by 20,000 of the Experian questions to see where you've lived since you were born. And most people can't get through those challenge questions. So I would say the big chuckle of the day is, how do I get my Home Depot discount card? That's probably most being utilized. And what is underutilized is VA healthcare by far. We have 50,000 veterans in our county. We have only 9,000 registered. And I would say our big disconnect is we have no VA clinics in our county. The closest clinic is Pontiac or Yale, or you go down to Detroit. So your primary care doctor can be at any three of those locations. I have done a big push to try to get a clinic. And then, since this is done at a federal level without state funding, the big pushback is we are focusing on places like Montana, North Dakota, and places where people have to drive more than 12 hours to get to a VA facility. I'm like, okay, I'll stop complaining. You know, the longest anybody pretty much has to drive is maybe an hour. But then the VA implemented the Veterans Choice Program, where if you live more than 40 miles away, they will approve you to see a local provider. The problem is it has to be contracted doctor, and not everybody's contracted with the VA. So they're really, you know, for somebody that lives in the Macomb area, the local provider could be Dearborn. I'm like, really? I have to drive by the VA to get to that. So it's really just finding those local resources in the community to get the doctors to sign up to be, you know, to be a contracted facility or contracted care provider. So big underutilized. I would like to see more people using the VA, because it's something that if they're entitled to it, they should use it. They might not need it now, but you never know when somebody needs a medication and it's $300 a month. Like Eliquis, or some of these brand names that aren't generic yet, that are just lifesavers to people in strokes and all of this, or the heart meds or the cancer meds. And if you could get that, even if you have to pay, and you only have to pay $8 or maybe $15 for a brand new med, that's way better than the, you know, $200 or $300 that you were paying per medication. So I always, you know, I say, hey, let's look at it. Let's just make a phone call and see how much if they carry those meds, and how much they would cost. And then I'm like, so then I look at the veteran. I said, now, is it worth your while to at least do this and go once a year? Because they'll mail you the meds. That's the easy part. You just got to go once a year. It's an inconvenience. It is a big inconvenience, but I'd like to see that being more utilized.
Thank you. That's a great idea. And I'd be curious to learn more myself on how do we sign up more contracted providers. And also a thought, I mean, it was a huge news expose around, delays in care through the VA. Has that diminished? Is that more accessible now? Have some of those issues been addressed?
So I can address our area.
Okay.
That's what I'm very in tune with. Most of our people, when I say our people that live in Macomb, they feed out of the Detroit VA. It's either Pontiac Clinic, Yale Clinic, or the Detroit VA. Some people will drive to Ann Arbor, but I don't go to Ann Arbor and I don't get the Ann Arbor statistics. So I can't really give an example of the difference between Ann Arbor VA and Detroit VA. I will say in our area, when we first started this 1-star, 2-star, 5-star kind of thing, we were kind of like maybe 1.5 star as far as customer service and getting the right care. And I think we've moved up to 3-star or 4-star now. It's really educating every veteran on how to use the VA. So it's not just people think, oh, I just call a doctor and I get an appointment today or tomorrow. It doesn't happen that way. So it's really, if it's in an urgent need, then we go to urgent care. It's really explaining the process of how to use the VA system. The reason why all of this was implemented years ago is because people were dying in the waiting room. People were waiting 6 months for their first appointment because there just wasn't enough. I would say that's definitely not the case, and it's never been the case here. You might wait 3 months or 4 months to see a specialist. But now the VA has these mandated laws that if it takes more than 30 days to see a primary care doctor, then they can send you in the local community. If it's more than 30 or 60 days to see a specialist, they can send you in the community. And the VA is doing that. The VA is going broke doing that. But at least you're getting the care that you need. And as I tell everybody, if you have an urgent issue, go to urgent care. You can go to the emergency, you can go to the local emergency room, but to get the VA to pay for the bill, they have to call the VA to get authorization. And if they don't do that within 24 hours, then the VA doesn't pay the bill. And then they kind of show up at my office like, well, what? And I'm like, so does the VA educate people on that? Not really. That's my job, because I'm seeing so many people coming back with bill problems, but they are getting better. The VA is just very slow in paying their bills.
Okay.
So
we have similar issues around Medicare and Medicaid at the state level. So I find that very relatable, but it is something that we can work on. Mm-hmm. And I'm going to continue, and I'm going to ask each person what is either a resource that is utilized or needed or underutilized, or your big idea to leave off our night. Christina, I'm going to you next.
So everything that we've talked about here tonight, this is one of the reasons why I think Warren, being the 3rd largest city in the state, we need to have our own Veterans Commission here to help navigate this system and to help the veterans find these resources or connecting them with these right resources. So if any of you are here in Warren, I'm going to ask you to reach out to your city council members and ask them to make sure that this goes forward, because we're still trying to get this forward. And then the other thing is, I know that I just got an email right now while we were sitting on here from the VA saying that the Michigan Veterans Employment Service is looking for some feedback from female veterans. If you have a few minutes, please take the short survey. They're just trying to figure out, why females are using the services or not using the services right now. Like I said before, there's a lot of female veteran services that are only provided on a certain day or maybe a couple of days. I think they're up to 2 or 3 days now. But they're not always provided. It's not necessarily convenient. So please take the survey so that we can get some more services provided to us. And I'll put it into our chat function here in a minute.
Fantastic. Thank you, Christina. Okay, Sue, I'm going to ask you, what are we leaving with? The big idea or takeaway?
I really liked what Laura talked about. So many people who work with veterans do not have a comprehensive understanding of the services. And I know Chris and I both went to a service officers training, and Chris has been back for more training, but even with his own personal issue right now, he's got one drug that costs $16,000 a month, and nobody can afford that. So, but what has happened is the VA, by getting in touch with him, someone he had talked to a long time ago, they are going to be able to help him out with the cost of that drug until our new insurance kicks in after January the 1st. But from the time that Chris has been diagnosed, he's had to pay $22,000 out of pocket for this drug.
And no one should have to choose between
No, they
medical
should not.
treatment and life and health. That's insane. It is definitely one of the issues we're tackling on accessibility, affordability of drugs and prescriptions and treatment at the state level. So thank you for raising that.
Yep.
Okay, Chris, you're next up.
Thank you, but my wife covered it.
Okay. Any other ideas or resources that you want to shout out?
Lori, I would like to follow up as far as what Christina said. I hope people that live in Warren really contact city council members and push to get the Veterans Commission done. You know, there's no conflict there. I think, one or two of the council members were concerned about that. The idea is, the closer you are to the veterans, usually it's easier to reach them. So if we can do something at the local level like that, it'll just help to get them in touch with the county, which, you know what I mean? It'll just make things work so much better, because all I ask usually to veterans is, reach one, teach one, try to get the education, try to put people in contact with those that can provide the services that they need. And most of all, let's just care and look out for each other, because that's really a lot of times what this comes down to, because so I know myself, I feel fortunate with that. And that's why I say it's something that I think we as veterans really have to do, is to try to do what we can to make things better. But most of all, I want to thank you for having this, because like I said, this is so important and this is such a great idea, and we'll reach a lot of people with this. So thank you for that.
Thank you so much. Yeah, I'm just going to echo the sentiment that our veterans and our community need to have voices at the table, help guide decisions and funding decisions locally and all the way up. And that's the best way to do it. I'm also going to add another voice to finish this out. Mark Kilgore, who I've worked closely with through Care of Southeast Michigan. He works with substance use disorder treatment and recovery community, and they offer services, and I'm going to throw it over to him.
Thank you, Lori.
Hey, Mark.
Hey, Laura, how are you?
Good.
Chris and Sue. I never met Joel and Christina before, but I have now. I just wanted to share with all of you that we received some funding recently from the Substance Abuse and Mental Health Service Administration to have a peer recovery coach paid apprenticeship program to train peer recovery coaches to work with veterans. And so we are looking also for veterans that want to become peer recovery coaches. It's a paid program. They're paid while they participate. They get all the training needed. And then we need to reach veterans. That's going to be the next problem, is reaching to the veterans.
Oh, no, it's not.
We've got a network.
Oh, yeah.
And I'm also working on another grant right now to expand other services and programs at CARE specifically for veterans. So that would be to support people with substance use disorders. They can have their own space at our office to hold their support meetings, at no cost. So hopefully this grant, we have to turn it in, I believe, in about the next 10 days. So hopefully that one will go through too. So right now we have 6 people in our apprenticeship program. Only one is a veteran. The other ones will be working with people coming out of prison. So we're going to need more veterans. The next round of apprentices will start in March. So
Hey,
we're
Mark,
going to be looking for more. Yeah, Laura.
reach out to Judge Fuca and Kara.
Okay.
Shoot me a quick email and I'll give you all their contact information, because we just had a graduation the Thursday after Veterans Day. And a lot of times when veterans graduate, they want to be mentors. They want to pay it forward. So this could be something that interested them. And plus they do have an email group with all it's closed. It's not open to the public. And it's just for participants and graduates, that graduates from the program. And, she can easily put it out on that and get some interest, especially for veterans. And Judge Fuca's court is mainly the non-felony, where the circuit court was felonies. And you might not see too many people wanting to do that there, but the Judge Fuca's participants, I can see it now. I've been part of her team for at least 5 or 6 years now, and we have graduates that, turn around and become great mentors and then pay it forward.
Okay, yeah, one of the requirements through the federal grant is they have to have 2 years in recovery from a substance use disorder.
Well, guess what? The judge program is 2 years.
Awesome.
So once they graduate, usually it's anywhere from, it has to be a minimum of 12 months, but some of them are 18 to 24 months. Yeah.
Right.
Fantastic. Well, it sounds like we have an amazing network started here. We have some great contacts, great resources. If you haven't already dropped your email address or contact information, feel free to add it to the chat function. If you're an attendee, I encourage you to copy the chat notes so that you can reference them in the future. And just thank you, everyone, for taking time out of your busy schedules to address this issue and to touch on resources that are available in our community. And we'll make sure that we continue to push this out and build on this in the future. So thank you so much.
Thank you for hosting us, Lori.
Glad to.
Thank you, Lori.
Have a great holiday. Take care.
You also.
Yeah.